Hello, everyone, and welcome to the March edition of the Science on the 7th live stream organized by HEI. I'm Pallavi Pant and very pleased to welcome you all. I'm joining you from Boston today, having just come back from Delhi after a few weeks. And tomorrow is International Women's Day, a day that we celebrate all of the wonderful achievements that women have made, but also focus and reflect on some of the challenges that we still continue to face in our societies. So today, in the live stream, we want to talk a little bit about how air pollution impacts women and what, if any, solutions have been implemented, are being implemented, can be implemented to address those barriers and to address those exposures that women have to high air pollution levels. I have two excellent guests here with me today. One is joining us from Delhi, Smita Rakesh, who is a vice president at Social Alpha. Welcome, Smita. And then our second guest is here from Boston, Jaime Hart, Associate Professor of Epidemiology at Harvard University. Welcome, Jaime. I'm really excited to have you both on our show today. Smita and I studied at the same university many, many years ago. And Jaime, as we just learned, had her first job through the Health Effects Institute. Fantastic. Really glad you can both be here. And I know that this issue of air pollution and how it impacts women continues to be sort of on the radar. We see lots of news headlines about it. I think we have a snapshot of what these headlines are often telling us, that air pollution impacts women disproportionately. We're not talking enough about the gendered impacts of air pollution. So if we can pull up the slide that we have here, there's just a variety of ways in which people are beginning to address this issue very specifically. You know, are we talking enough about women's health in the context of air pollution? How do we bring in those impacts and make sure that we address them as we plan for solutions? So, Jaime, I want to start with you. When we are thinking about the disproportionate impacts of air pollution on women, what exactly are we looking at, and how do we come up with with these statements and what science is telling us?
Yeah, thanks for having me today. I think it's going to be an exciting conversation. And I think there's been a growing, concern about women's health specifically with air pollution. Some of the earliest studies of long-term air pollution were in cohorts with both men and women, and people didn't look differently to see if there were different impacts. And then there were a number of cohorts of just women that were showing more elevated effects than what had been seen in the mixed cohorts. And so this started off this thought that there was possibilities that women were exposed to the same air pollution were having more effects. And so that story has been going along. Sometimes there's evidence for it, sometimes there's not. But what's been really interesting is that there's a really growing body of evidence showing that all the different parts of a woman's life, that air pollution may have differential impacts. So while you know people are pregnant, they may be more susceptible to the effects of air pollution, and that those impacts may lead to later life cardiovascular disease. So for example, having air pollution be leading to complications during pregnancy, that puts you at a higher risk for future cardiovascular disease. So again, there are these sensitive windows where people are at more risk than they may have been, otherwise. And one thing I will say that we have to be a little careful with the literature. Some people, when they're talking about women in the literature, are using that as a measure of biological sex. Some are using that as this, the behaviors and societal, gendered issue. And I think that's a little muddy. So if I use that term indiscriminately, female and women, it's because the literature is really messy. And so I think that's just an important thing to think about. But yeah, there's this really emerging thread that, during certain windows, earlier, menopause, delays in fertility, acceleration of, menstrual cycle starting. So again, all of these things that are particularly susceptible, women are, more likely to be exposed to than, those who are assigned male at birth. And so that's really that. So a lot of those headlines that you were showing were really pointing out those sensitive windows, and that these outcomes that are in those assigned female at birth were definitely more susceptible to air pollution, and really hadn't gotten the attention that things like cardiovascular disease and mortality had gotten. So I think that's where that disparity is really coming in. But I think we're making great strides in that area.
Great. Yeah, I think, there's sort of so much news about how air pollution is constantly impacting all of our health, especially, as someone who was just in Delhi, Smita, I know you live in Delhi, air pollution is always in the news. And we're all worried about what it means for our health. But if we start to go a little bit beyond the science, we also know that, air pollution, women's health, and clean energy are very intricately connected. And Smita, you've worked in the field of clean energy for 15 plus years now. So, from your point of view, how do you see those intersections? A lot of people don't really make that clean line between clean energy investments and women's health and air pollution. So, can you tell us a little bit more about energy access, air pollution, and women's health, and where we see those linkages very clearly?
Thank you. Thanks for having me here, and great to meet Jamie as well. It's a very, very complex intersection, right? In itself, each of these three areas have layers and complexities, whether it's health, gender, or air pollution in itself, and add to it energy access or lack of energy access, so to say. And it just is a very, very complex intersection, right? I think Jamie spoke about how women's health is far more vulnerable to the effects of air pollution. Air pollution is the most visible and the biggest environmental risk today, right? But in terms of exposure, and especially when I narrow it down to the context of lack of energy access, where more than 50% of the world's population uses biomass based fuel indoors for something as basic as lighting, cooking, and even space heating. We are talking about much increased exposure for women. And let's not forget that, while there are structural gender imbalances and inequities, there are intra-household inequities. I've, for instance, seen in so many, of these field visits and project visits, that if there is something that's rationed, that's little, it's women who get the lesser share of it, right? Disproportionately lesser share of it. And it's something that women are also fine with, have been historically fine with, right? So cooking, for instance, right, is a problem where women work with, but it's considered to be a women's problem, whereas it impacts the household air pollution, and household air pollution alone, has been studied to be responsible for premature deaths and disabilities. So women, whether it's women who are working on cooking indoors, or they are spending their time extra hours getting exposed to air pollution while fetching wood, lack of clean energy access, and understanding that context. It's far more intense in terms of the impact it has on women's health, but also not to forget, the newborns and the children who are
Mm-hmm.
working closely around their mothers as women are cooking, or working around biomass fired space heaters. Yeah.
Mm-hmm. Yeah, I think, there is definitely so much in this complex intersection that we probably need 10 more live streams to peel some of these layers. But I'm gonna come back to the question around newborn health and, how women's roles can play into the impact it also has on children. But if we stay a little bit more for the minute on the impacts on our health, Jamie, you just talked about various studies that have been done in different parts of the world. We've looked at cohorts of people. So, can you tell us a little bit more? When you say cohorts of people, what do you mean? How are we picking these people? How are we studying the impacts of air pollution on men and women? And then, how can we tell how these impacts might be different for some versus others?
Sure. So there's a lot of different ways to build a cohort. So you can go out and enroll. So in the work that I do, we went out 3 times. We're actually doing it again, and we enrolled cohorts of nurses. So we found registry lists from different states, and we identified women who had a nursing degree, and we sent them an invitation. And we did that in 1976, and 121,000 women have been answering our questionnaires every 2 years since. And so that's one way to build a cohort. A lot of other ways, and this is a little more common in Europe, in other parts of the world, is that you have these big registries of the population. And what you can do is you can use that to follow people Again, sometimes sending them questionnaires to get information, and sometimes just using the data that's available to the government because they're paying the health insurance or things like that. So essentially, you go out, you find a way to get a large number of people, and you follow them for as long as they'll let you in some cases. And what you do is you may ask them about health effects. You may look in a registry or a medical record to find health effects. And then what you can do is you can compare in this case, the outdoor air pollution levels or indoor air pollution levels of those people across the cohort, and you look to see if individuals who have higher levels of exposure have higher levels of the disease outcome you're looking at. So you can do that for any outcome that you can find information on. And then if you want to compare, if you have a population that has both men and women, you can do separate analyses in both of them and look to see if you get different effects in the two groups. And so you can explicitly look to see if there are differences if you're able to have a population that has both. And so that's kind of the basic way you run a cohort. And there's lots of permutations and lots of fancy things we can do, but in general, that's pretty much how we do them. And again, you need information on air pollution, which you can get from either monitoring networks or satellites or models that people build. And so there are lots of different ways to get those exposures.
Great. Yeah, I think as sort of I've heard and seen, a lot of the cohorts can take a lot of time and energy to build and to retain the people, so that you can continue to get that kind of information from them over long, long periods of time. And I think another context in which we hear a lot about cohorts is when we try to run programs, accelerator programs, solutions, and I know that's the space, Smita, that you're very familiar with. If we hone in and sort of zoom in on clean cooking solutions, that has been a focus. We know that household air pollution, especially linked with cooking, is really responsible for huge exposures. Studies have found that as much as 20 to 30 times higher exposures if we cook with solid fuels like animal dung or wood or charcoal. So in programs that are trying to promote clean cooking solutions, what has been your experience in terms of, do women participate in programs like that? What kind of engagement do they have? There's often also barriers to entry, engagement. You talked a little bit about household roles that can play in as well. So tell us a little bit more about your experiences in that arena.
Honestly, and on this, it sometimes becomes a little bit of a very introspective rant as well for me, because when it comes to gender, when it comes to women in the most marginalized, underserved segments, you often realize that everything that you've done sometimes becomes more counterproductive than productive, right? And I'm just introspecting for the entire sector.
Mm-hmm.
One of the things that I've actually struggled with, and I've felt like, and I mean, seeing it in the sector, it seemed so painful, is that we always talk down, right? We say that a
Mm-hmm.
behavior change is needed. We always go to these communities and say that whatever you've been doing and your mothers have been doing, the way you've been cooking, the fuel you've been using is all wrong, and you've got to change overnight to something clean. And imagine somebody like me coming from Delhi, which is infamous for air pollution. They know I live in a city which makes me as much at risk as it puts as their cook stove puts them in. So it has been a very preachy, talking down behaviors, to be honest. And that's been one of the I think one of the biggest bottlenecks of why some of these programs haven't addressed the solution. It's a tragedy that clean cooking, something as basic as this, we still struggle with and haven't managed to solve. While we have some solutions, mostly one of the other barriers has been that users, women who are cooking, are not included while designing those solutions, and therefore what comes to them is something that has been designed with inputs from stakeholders and donors. And I'm sorry if I sound provocative and a little upset about this, but this has been a problem. So inputs from everybody but the one who is going to cook on it, right? So many a times we've seen that, and we've done some very interesting field level studies to see mock auctions, reverse auctions, like so many of these studies to see what exactly do women value when it comes to the range of cooking solutions they work on. And you'd often realize what they like is what they'd not put their money on, also because, like I said, they're not making the buying decision often, right?
Mm-hmm.
So participation of women, I feel like is there because it's something that affects them. But do we approach it the right way in terms
Mm-hmm.
of including both men and women, because ultimately it's the health of the household, into the conversation, not making it preachy or talking down or telling them that everything that you've done so far is wrong and here's, you know, I sometimes get very upset with behavior change communication because it talks down. And one of the interesting stories, I want to share with you all on this, is that sometimes just awareness is the best way of behavior change. Just
Mm-hmm.
sharing some of the information. Usually, when we go to the field, we collect data, we analyze it for our own work. How much of it do we give back, right? So we were doing a study with some of the sensors in the field to study adoption of clean cooking solutions.
Yep.
And some of these sensors were giving the information back to the women in very usable, like sound form, saying, okay, your exposure is high, move on. And what we realized was just informing through use of technology or with or without technology, and leaving them to make those decisions. They do take care of their children. They're worried about their children's health. They're worried about their own health, and they would be taking some of those decisions. Of course, not everybody is empowered to take all the decision, when it comes to finances. But in terms of immediate behavior change, I think empowering someone with information works better than actually telling them how their behavior should change overnight.
Yeah, I mean, that's such a powerful message. I think, true for so many other fields as well, that empowering people to make the decisions and giving them the information they need can often trigger the changes that we want. And that actually brings me to one aspect, which I think has been very helpful in generating more awareness and interest around reducing exposures from use of solid fuels in particular. And in many stories and news articles and scientific articles, we continue to hear that when women are exposed to air pollution during pregnancy, this could be because of what cooking fuel they're using. This could be a variety of other sources of air pollution. This can impact their newborns. And one of the reports that we released a couple of years ago found that more than 200,000 infants were dying as a result of exposures that their mothers had. And this is not including all the infants that were born perhaps prematurely, perhaps had other, health issues over the course of their lifetime, particularly in the first 5 years. And people are starting to bring that kind of information to mothers and to families, not just the mothers, but the entire households, as you were also saying, Smita. And if I can pull up a couple of images of, what we typically think of like cooking, it is a woman's task in many societies, whether we like it or not. Women are responsible for cooking in places where we have fuels like charcoal, wood, animal dung being used. It's also women who are going out and collecting a lot of that fuel. So, Jamie, I want to turn to you for a minute. You know, when we say that exposure during pregnancy can impact not just the mother's health, because there's also cases of gestational diabetes, for example, blood pressure, etc., also impact the newborns. Can you tell us what do we know about these health impacts on mothers, expecting mothers, and their children?
Yeah, I think that literature is really terrifying when you start to dig into it because, it's such a broad spectrum of impacts from everything from spontaneous abortion to premature labor to, harming the, lungs of developing infants that, then later lead them to have, respiratory issues as they get older. So there's a lot of emerging literature showing that in utero exposures can really lead to, complications throughout childhood. So even if you did, do something to reduce your exposures, that exposure's already happened in utero, and so you sort of set your child off on a less than optimal path. And again, I think that's really powerful. But one thing I always like to stress is that being careful when talking with especially pregnant mothers, that you don't cause such stress about this
Right.
that you also lead to bad health effects. But I think it is a really powerful message that if you're really invested in child health, even in societies where maybe we don't care as much about women's health, but we really care about child's health. And especially there's a lot of evidence showing that male fetuses are more susceptible to the effects of air pollution when in utero. That sometimes is a more compelling argument, unfortunately, in some societies. And so I think, again, having that information and knowing that it's really impacting everyone birth to death
Mhm.
is such a powerful message that, if you can get that information into people's hands, they then, can empower themselves to, make choices, but also to really pressure their governments to do better. Because I think that's where a lot of this has to happen, is that governments need to do better. And the
Mhm.
only way they do better is when we make them. So I think being able, sometimes, the childhood argument is a more compelling story for some than, the health of adults, which is a sad statement on the world, but I think is it's reality in a lot of places.
Yeah, no, that's very true. And I think in many countries, we're starting to see that parent groups and especially mothers groups are making air pollution an issue that they're spending a lot of time and effort on. In the US, we have the Clean Air Action Moms who have been mobilizing support for addressing air pollution. In India, we have Warrior Moms who are trying to raise awareness around health effects of air pollution on women, but also what the impacts are on their children. In the UK, we've had excellent people who are speaking to this issue as well. So I think again, sort of going back to this idea that we have science, it's continuing to grow, and now getting that information in the hands of the people so that they can decide how they want to use it to make personal changes or to pressure governments to make changes on their behalf. And I think just to add a little bit of positivity into this, at least in the clean cooking space, over the last several decades, we have seen change. In even in India, we have seen a reduction in the number of households that are using solid fuels for cooking. In China, we've seen a massive reduction for both cooking as well as for household heating during winters, which can again have those similarly high exposures. So there are stories of hope and change and positivity, and hopefully with the work that you're both doing and also that others are doing, we can continue to press for that type of action. In the last few minutes that we have together, I did want to talk a little bit about your personal stories, because you're both excellent female leaders and inspirational figures who've been working on various aspects of air pollution, energy, climate, and health. And I'm sure you've had lots of experiences through your careers. So maybe, Jamie, if I can start with you and ask you to tell us a little bit about your career trajectory, and within that, your experiences as a woman navigating the fields that you worked in.
Sure. So I'm an only child, and first in my family to go to college. So I went to a women's college, which was not really the plan, but it's where I learned the power of women working together is is a formidable force. And there I couldn't decide what I wanted to major in, so I majored in both government and biology because it was kind of the two sides of what was happy. I didn't know public health existed, but apparently I was headed that way even from early trajectory. And as we mentioned in the intro, my first job as a research assistant was funded by the Health Effects Institute on a feasibility study in truckers. And so I'm from a pretty blue collar family. I have a lot of truck drivers in my family, and so I think that played up in my interview. And so it was actually really great. Actually, being a woman in a study enrolling truckers in the trucking industry was pretty interesting. Women were not.
Sure.
There weren't a lot of women on those trucking industry docks, so that there are some stories that maybe are not suitable for the internet, but that were pretty interesting. And but I was really lucky. I landed in a very supportive mentoring team of both men and women. Francine Layden, who's a big name in the air pollution world, was my boss when she was a postdoc, and we've grown up together. She was my thesis advisor, and so that for me was really powerful. That as someone from a blue collar background where no one even went to college, like being able to see a woman, be a professor at Harvard, right? Like that, like again, that there that's an increasingly common thing. But for me to be able to see that, it was really powerful. And so, when I was trying to decide what I wanted to do next after being the research assistant, I had multiple people around me be like, you're really good at this. You really enjoy this. You should go get a degree to do this. And it was funny because I was kind of like, me, like this is ridiculous. I can't go to Harvard. Like I'm a blue collar kid from the country. And so I think but it was really useful to have like all that supportive mentors, including like really powerful women who were, kind of had my back. And so that's been my philosophy. Like with our lab group, we're diverse in every aspect we can. I think we have more women than men by about a factor of two. And I really enjoy that. And I really enjoy, I take it really seriously that, my job is to, make sure, tread, break ground for the next generation as well. So it's easier for them than it was for me. And, I really respect all the women who broke ground for me so that I can be where I am. And so I think it's a really, it's been really pleasant for me to have those experiences. And I think, I got really lucky in a lot of ways that, I happened to take a research assistant job at a place where I never left. So I just moved back to an office that is below my first office from 20 years ago. And so it's been a good homecoming month. But
Yeah.
that's sort of how I got where I am. And yeah, I think it's a combination of luck, hard work, and some really great advisors.
Yeah, I think I want to pull up a picture from your lab that I think we have. And if people want to learn more about this amazing lab that Jamie is running right here in Boston, check out their website. But I think I would agree with you, having supportive mentors and people that can, show you that this is achievable is important. I feel that, even in my case, Smita, turning to you, what has your experience been like and how did you get here?
Very interestingly, even when environment and sustainability and climate were not buzzwords, somehow growing up years, we were always, taught how we need to value water just because it runs in our tap. There are people who don't have access to it. And I feel like a large part of our, regular upbringing, regular upbringing, and I give a lot of credit to my mother, who's the most biggest role model I've had in life, was about valuing resources, valuing nature, and not really using the word environment. And then studying geography and studying about climate science is where environment and climate became a stronger foundation. This was something that I was always passionate about, and I think just studying it at undergrads made me more aware of what this was and where my calling was. And I think I'd always been a very community driven person. I've always thought we can't not be inclusive in our approach. So while working in environment and energy, and while we're saying we need to move towards renewables and clean energy, the access side of things has always been a very primary driver. So my work has always been at the intersection of energy and communities, or climate and communities. And all through my course, I've learned so much from, like Jamie said, from mentors, both men and women. Seen some fiery women, who would just, like, audacious, ambitious, bold women who would just
Mm.
redefine a lot of what society's expectations from you are. And also so many of these women in the field who you'd see be assertive, in a structure, in a setup where you'd least expect them to speak up, and you'd see
Right.
them be so assertive and truthful. So many of these inspirations, through the journey of my life so far. But the ones I've learned the most from have been the most audacious, most bold, women in my life.
Amazing. I think we all want and need more sort of leaders and inspirations like that. And I think in closing, if I could ask you both, I'll come to you first, Jamie, and then come to you, Smita, to just summarize sort of, in 1 minute, when you're thinking of air pollution and the impacts on women, what are the 2 or 3 major takeaways that you would like our listeners to take away from this discussion today?
Oh, that's a tough one. I think I would say that one, we don't know enough yet. It's still an understudied area. Even though we're 50% of the population, we're not 50% of the research.
Hmm.
And that the more we study, the more profound it is, both the indoor and outdoor impacts of air pollution on women and, their children and their families is just, it's astounding how large an impact it is and how little conversation besides these types of conversations, it doesn't get as much
Hmm.
attention as it probably should.
Yeah, Smita.
Sticking to the theme that I was speaking of access, I would say, all three things are needed. One is the right market. So basically, the right products in the market, which address the needs for how which control household air pollution. So having the right products at affordable prices. So the market has to work for energy access. The government has to work, because this is all broken infrastructure that people are paying for through their lives, right? And third is obviously, like what we discussed, information symmetry. As much of the scientific information, as much of whatever we know, as much of evidence that we can share back with the communities who
Mhm.
we want to make bolder and stronger choices for themselves, instead of just having funder driven or donor driven programs. I think these three things will change the game.
Great. I think very, very useful nudges here for our scientific community, for our investment community, and for many others who are hopefully listening in. Thank you so much, both of you, both Jamie and Smita. I'm really glad you could join us from very different parts of the world. And if you are interested in hearing more from inspirational women, do check out our previous live streams. We've brought on many of them. We'll continue to bring in many more. And to all of you who are celebrating tomorrow, a very happy International Women's Day. We will be back in April with some more conversations on air pollution and health. Thank you again for joining us, and goodbye for now.
Thank you.